Hi, Mr. Miller. I'm Jane Smith. I'm the school psychologist.
Hi, it's nice to meet you.
Thank you so much for coming in today. My hope for today is that we can discuss some of the results from Johnny's evaluation, and talk a little bit about what you've been noticing at home in terms of what's been going really well for him academically, and maybe if there are any areas where you've noticed him struggling, and then to look at how we can use this information to provide the best support for Johnny. So please know if at any point you have any questions, don't hesitate to jump in and ask at any time. But I noticed when I was looking at the observations in the testing report that the evaluator mentioned that Johnny was such a hard worker and really paid attention and stuck with the tasks even when they were difficult for him. He stayed focused and really gave his best effort, which is wonderful.
That's great to hear.
Oh, absolutely. I mean, I think that's something that will both help us to feel confident that the results we got give us a good estimate of what he's capable of. And then also because it serves him very well in school and in life. I know his teachers have written that he is one of the hardest workers that they have seen. So
Okay.
that's wonderful. So we did several different types of testing. We looked at cognitive testing, which explores how Johnny processes different types of information. We looked at some academic achievement testing that looks at his performance in some specific areas of reading, writing, and math.
Okay.
And then some behavioral evaluation, where we look at the rating scales you completed, where you're comparing Johnny's behavior, basically to that of other children his age.
Okay, so the scales that I did a little while back will be part of these results?
Yes, absolutely, absolutely.
Okay, good.
So when we're talking about the cognitive and academic testing, we'll be using standard scores to describe those results. And so what that means is that the numbers I'll be sharing with you are different from what you might see on Johnny's report card, where you're looking at a percentage out of 100. So
Okay, so these tests is not out of 100.
no, right, that's exactly right. So when we're talking about these results, we're looking at kind of 90 to 109 as sort of the average range. From there, 80 to 89 would be considered the low average range.
Okay.
70 to 79 would be borderline, and then below 69 would be considered that lower extreme range.
Okay.
So that's kind of the reference point as I'm describing the numbers and the scores. That's sort of the scale we'll be using. Does that make
Okay.
sense?
Yeah.
So looking at the cognitive testing first, the first area we looked at was verbal comprehension, which looks at Johnny's ability to identify relationships between words, to complete some verbal analogies, and to use vocabulary to kind of solve those types of verbal problems.
Okay.
Performance in this area tends to be most closely connected with performance in reading and writing. And Johnny scored 105 here, so right in the average range.
Okay,
So
great.
right where we would hope to see.
Okay.
The next area we looked at was fluid reasoning, which looks at Johnny's ability to observe a series and find patterns, and really to look at nonverbal stimuli. So we're not using vocabulary or words here. We're looking, just at nonverbal type puzzles. And this area tends to be most closely connected to math reasoning skills. And Johnny scored 71 here, so in the borderline range. And I think what's significant there is looking at the difference between his performance in the verbal type tasks versus these fluid reasoning tasks, that there is a pretty significant difference between his performance in those areas.
So you're saying that the fluid reasoning is connected to math, because math is an area that he's really struggled with a good amount. And
Okay.
So is that...
Right, so that would be most closely connected with math,
Okay,
absolutely. The next area we looked at was visual spatial processing, and this area also tends to be connected with math. So the tasks in this scale are looking at solving puzzles, manipulating figures, and recognizing relationships between shapes and objects. So this would be sort of somewhat connected with completing puzzles. I don't know if that's something Johnny enjoys doing at home.
Well, I know he's always struggled a little bit with Legos. It's something that his sister does really well, but he's always kind of gotten frustrated when he tries to put something together and just can't quite get it.
Okay, so that would absolutely be connected to this type of processing. And Johnny scored 74 here, which would be, in that borderline range. The next area we looked at was processing speed, and this looks at Johnny's ability to quickly and fluently complete simple tasks. So, how fast can he take in information, process it, and provide a basic response? This area can also be significantly impacted by attention and focus. So, this shouldn't be an issue in Johnny's case because I know that the evaluator said that he was very focused and sustained attention very well. But that would be a task demand here. And Johnny scored 95, so right in the average range again.
Okay, great.
The last area is working memory. So the working memory tasks look at Johnny's ability to hold things in memory and complete simple manipulations. So maybe a string of numbers that he might have to remember and repeat, or repeat in a different order. This area also can be impacted by attention. And Johnny scored 99 here, so right in the average range.
Average. Okay, great.
Yep, absolutely. So, from this test, we're seeing that verbal comprehension, working memory, and processing speed are all strengths for Johnny. And fluid reasoning and visual spatial type processing are areas where he tends to struggle a little bit more. We also calculate what's called a full scale ability score, and that's where we're looking at, overall, what is our estimate of Johnny's, cognitive processing ability. And he scored 83, which would be in the low average range. But that said, I think in Johnny's case, because there's such significant variation between his performance and verbal comprehension, working memory, and processing speed, there's such significant difference between his performance in those areas and then his performance in the visual, spatial, and fluid reasoning. I think we are better to really think about his performance on each scale as opposed to the overall, because the overall may not provide the most accurate picture of his ability.
Okay.
Does that make sense?
Yeah, that makes a lot of sense.
Next, then, we'll discuss the academic achievement testing, and we're using that same scale, so that 90 to 109 is kind of the average range.
Okay.
In reading, we looked at Johnny's ability to do some basic reading, some reading comprehension, and then reading fluency. The basic reading task was we asked Johnny to just look at words from a list and read them. So some may have been really easy for him, and some may have been more challenging and required him to use some of those decoding skills. And he did very well. He scored 108, so sort of the high end of that average range.
Oh, good to hear.
His reading comprehension, gave him some context. So he had to read some passages and demonstrate his understanding of those passages, either by answering questions or filling in some missing parts within the text. And he scored 102 there. So again, right in that average range.
Okay, great.
And then lastly, in reading, we looked at reading fluency, where Johnny was asked to read some words that may have been familiar or, not as challenging for him, but to read them rapidly and accurately. And he scored 107 there.
Okay, so the higher end of average on that one again.
Yes, absolutely. So reading seems to definitely be a strength for Johnny. Does he enjoy reading?
He does. He likes to read a lot at home and write things. I think that math is the one area that he has struggled with, but writing is something that he's always really enjoyed.
Oh, wonderful. Wonderful. So then moving on and talking about his math. In math, we looked at two areas. Math calculation, which is basic paper and pencil math, so some addition, subtraction, multiplication, division, just performing the basic operations. And Johnny performed within that borderline range again, so he scored 72, which is very consistent with what we might have expected given that cognitive testing. Given the cognitive testing that we did, and it sounds like consistent with what you're seeing at home too.
Yeah, I would say that's true.
Okay, and then the other area of math we looked at was math reasoning, where Johnny was asked to complete some kind of practical math problems, some word problems, so to be presented with some information, identify the operation that needed to be completed, and then solve the problem.
Okay.
And he scored 75 there, which again was quite consistent with what we would expect given the cognitive testing results.
Okay.
The last area we looked at was written expression.
Okay.
Where Johnny was asked to respond to some writing prompts, either with sentences or longer paragraphs around a central idea. And he scored 95 there.
Okay. So that's within the average range then, correct?
Yes, absolutely. Okay. So, in his reading then, he's right there in the average range. Writing, he's right in the average range. It looks like his math is definitely the area where he struggles more.
Okay.
And then in terms of writing, does Johnny, does he enjoy writing? Does he seem to, is that something that he would do?
Yeah, I think that he'll like to write stories and things like that sometimes. So.
Oh, good. And that's a tremendous strength to have, and something that we can definitely use as a building block when we're looking at interventions and ways to support Johnny in math. Knowing that he is a very strong writer and that that's something he enjoys can really help us in terms of looking at what supports we're able to offer and what intervention strategies we might want to use. The last type of assessment we did was that behavioral assessment, like I mentioned at the beginning, and this is where we look at the rating scale that you completed. When we're looking at this, we're actually using a different type of score here. So we're not using standard scores when we talk about this. Okay. We're using what's called a T-score, which just means that our score ranges are different. So here we're looking at scores below 60 being considered to be kind of within that normal average range. Scores from 60 to 69 would be considered slightly elevated or at risk, and those would be areas that we'd want to watch and monitor and make sure that, in the future we don't need to provide some support. Okay. And then any areas where the scores fall above 70 here, we would consider to be clinically significant and something where we want to look at providing some intervention now. Does that make sense?
Yeah, I think that makes a lot of sense.
Okay. So this scale looked at some internalizing type behaviors, so things like maybe tending to feel more anxious or depressed or withdrawn. Some externalizing type behaviors, so things like aggression toward others or conduct type issues, and then just kind of behavioral symptoms overall. And the ratings that you provided then are compared with ratings of thousands of other children across the country. And in all those scales, so internalizing, externalizing, and overall behavioral symptoms, all of Johnny's scores fell within the normal range on the scales. Okay. I did notice that in terms of the specific areas of hyperactivity and impulsivity, Johnny did have some slightly elevated ratings, which just means that those are areas where we want to work together to monitor. I don't think that there's necessarily any need for intervention at this point, but I think it's just important for us to communicate with each other to make sure that if those areas were to become an issue down the road, that we want to just make sure we're providing that support. And I don't know, is that something, the hyperactivity and impulsivity would be things like having excessive energy or difficulty sitting still, not thinking through decisions before making them, or those concerns that
Well, yeah, I think he's always been a really active kid. He's always jumping around on the furniture and climbing on things that we try to get him not to. But so it's definitely something that seems to be something we see sometimes.
Now, from what I understand and from what I read in Johnny's records, he doesn't have any medical diagnoses or mental health diagnoses or anything like that.
No, I think generally he's been healthy, just the normal colds and flus that the kids get. So.
Okay, all right, that's wonderful. That is wonderful. Do you have any questions about any of those results before we move on and kind of talk about what we do with this information?
No, I think that makes a lot of sense. I think kind of summarizing what I heard was that his reading and writing is doing pretty well, but it's really the math that he's having some troubles in.
Okay, yeah. So the reason we did this evaluation was to look at whether Johnny might meet the criteria to receive special education services as a student with a specific learning disability. Is that a term you're familiar with or have had a chance to talk
really.
with?
So a specific learning disability?
Yeah, so what that means is that a child may have some processing difficulties in either one area or several areas that impact their ability to succeed academically, in reading, writing, or math. So for Johnny, looking at the cognitive processing evaluation that we did and the academic evaluation that we did, it looks like he does have some processing issues in fluid reasoning and visual spatial processing that are adversely impacting his performance in both math calculation and math reasoning. And it sounds like that's consistent with what you've been noticing as well.
Yeah, I think that sounds very accurate.
And I know that Johnny's teachers have indicated that they've done some pretty significant intervention and provided some support in the general education setting. And he has shown some growth with that intervention, but the growth just hasn't quite been enough to help him to be, meeting those grade level expectations. And so what we want to do is we want to make sure that we're providing him that support to be successful and to be able to perform with his peers who are his age. Does that make sense?
Yeah, no, that makes a lot of sense.
So given that Johnny does meet the criteria to receive special education services, and then what would happen from here is that you'd be contacted about having an IEP meeting, and in an IEP meeting, what will happen is you'll take all this information, so, data and observations that you provide, both during that meeting and through the ratings you provided, all the testing data, information from evaluations that have been done in the classroom, information, results from the interventions that his teachers have been doing. You'll take all that information and look at, okay, what services, what supports, and what specialized instruction does he need in math calculation and math reasoning. The results that we have here suggest that he should be very successful in general education, in reading and writing. So we'd really be focusing on that math in terms of our specialized instruction.
Okay. So really it would be just focusing on the math and trying to help him improve that area of his school.
Yes, absolutely. And are there questions you have at all about anything? I know we've gone through a ton of information.
No, I think you've done a great job of explaining it. I really appreciate it.
I hope that you know that if at any point, during this process, if at any point you have any questions, please don't hesitate to contact me. I'm always happy to, to help however I can, but I do think that this information is going to be really helpful for us in terms of providing Johnny the best support that we can.
Great. Well, thank you very much. I really appreciate everything.
Thank you.